With the hit series Breaking Bad ending little over a year ago, and the new spin-off series Better Call Saul airing next year, it is a good time to talk about a major factor in Breaking Bad: crystal meth. While heavily romanticized in the series, the reality is vastly more grim. Crystal meth, which is short for crystal methamphetamine, is one of the major forms of methamphetamine, which hereinafter will be referred to as meth. Meth is one of the most dominant drugs and in turn threat to our society, and is in the same class of drugs as cocaine and other powerful street drugs. But however, is considered a club drug, as it is regularly taken at raves or nightclubs. Its street names vary, most commonly known as crack, chalk, ice, speed, and glass. It is taken in three major ways: snorting it, inhaling through the nose, injecting it via a needle, or smoking it. However, it has been named to be taken orally. The symptoms of the high achieved from this drug is a false sense of happiness, a rush of confidence, and hyperactivity and energy. This has been known that while on the high there is a loss of appetite. This is shown in the show as Skinny Pete is truly, well, skinny. However, the physical and mental effects are far worse. The short-term damage involves a severe physical and/or mental breakdown. It later causes a decreased feeling of hunger, leading to weight loss, as mentioned before, and also negative effects, including nausea, increased aggressiveness, hallucinations, panic and psychosis, and finally convulsion, seizure, and possibly overdose. The long-term events include major damage to blood vessels of heart, which cause heart attacks, strokes, and of course death. Liver, kidney, and lung damage and destruction of tissue if in nose if sniffed, respiratory problems if smoked, and infectious diseases and abscesses if injected. It can cause malnutrition and weight loss, as well as severe tooth decay, disorientation, psychological dependence, psychosis, depression, and damage to the brain similar to epilepsy. Now, there are three types of users of meth: low intensity, binge, and high intensity. Low intensity users swallow or snort commonly for extra stimulation so they can stay awake long enough to finish a task or a job, or they want to appetite suppressant effect to lose weight. This isn't a safe path, as low intensity abusers are extremely close to becoming the next form of abuser. Binge abusers smoke or inject meth with a needle, which causes a more intense dose of the drug, which in turn leads to more severe rush that is psychologically addictive. In turn, like low intensity, if binge users continue on this path, they can turn into high intensity abusers. The final form of abuser is high intensity. These are full-on addicts. They dedicate their existence to prevent the inevitable crash, mental or physical, and this is a painful, once again, letdown mentioned before. This causes them to take more and more meth, and thusly causing the spiral of addiction, which in turn, as we've heard many tragic stories over many years, will lead to their death, as well as damaging family and friend relationships. Now, meth is an atrocity, so please enjoy the show Breaking Bad and Better Call Saul next year, but don't for one second think that what happened to the show is anything close to a real thing, because it is truth, it is a lot more horrific.